So this is before we did bi-jaw surgery, not only to improve the facial aesthetics, but mainly to correct the sleep issue. He has a very severe obstructive sleep apnea. And this is him on the table. You see the huge improvement both in the positioning of the chin and also the upper jaw. So a counterclockwise movement was done on the upper jaw. That's the front view for you. And this is the current front view. So the upper jaw was advanced by 3 millimeters. We did a counterclockwise rotation by 7 mm, mandibular advancement by 10 mm, and genioplasty by another 12 mm, 12 millimeters. Anesthesia is given by transmandibular approach to let us work on the entire face.